My name's Dennis Mcgee, and I was born here on the Pala Indian Reservation in 1937. I was coming back and forth from San Diego in the beach area, South Mission Beach, to Pala here where my grandfather lived. And he was living here alone by himself. So I decided to come and move in with him, sort of more or less take care of him, and watch out for him. And after a period of time, he had passed away, and I had become involved in some of the things, tribal affairs, while I began my stay here. The state health department was going around the different areas, checking out for services that were needed in any of the areas, and mine was one of the worst. There was no health care at all. Everyone had to go to town to visit the doctor. So from those visits, the state health department announced that they needed help badly for health care in California and more so in Southern California. There was a person on the reservation named Bobby Lovato who belonged to a committee that was thinking about doing something about health care. And I was at his home one day visiting him, and he asked me, he said, why don't you come to one of these meetings I go to and we see if you get interested, And I said, okay. So when I got there, he introduced me as the new delegate from Pala on the committee. And I kind of stared at him. But that was it. I couldn't get out of it. We incorporated in 1970 with 4 people, and we added on 2 more to make it a corporation. They were outreach workers and drivers, going into town taking the patients. 4 people. Today there's over 150 staff people. It's grown immensely. I was selected as a Kennedy Memorial Fellowship, and it became very interesting because the Kennedy family, were very interested in what the memorial was doing with the fellows. So as a consequence, Joe Kennedy came out and stayed with me for a week to see what it was like living out here in the rural area. It was the only healthcare center in Southern California that was dedicated to Indians on the reservations. So it served a real good purpose. When we first opened up with the first clinic, it was just medical, dental care, and just basically a general practitioner. And as time went on, we increased our funding more and more, increased our staffing more and more, and eventually it came out to where we have a $500,000 facility on the Rincon Reservation, first-class outpatient facility, and fully staffed. Bobby Kennedy Jr. and his sister came out for the opening. So there was a lot of fellowship with the Kennedys, and it really did help. For me, it's just so gratifying to see people happy with what they have today. It's one of the first health centers in the country that is currently serving their people.
My name's Orvin Hanson. I'm the Chief Executive Officer at Indian Health Council. I've been honored and blessed to work 29 years at IHC. I came in and started as a staff accountant in 1992 with an organization at that time that had close to 40 employees. And at that time, there was a great relationship between community health. So we really tried to make sure that we worked together, whether we were going out in people's homes or people were coming into the clinic for medical care. So in 1992, we were across the street in the brick 5,000 square foot building where we housed, at that time, medical and dental inside that building. We ended up probably with a total of 5 additional 1,500 square foot trailers. So at that time, with that growth, we knew, being driven by Dennis Mcgee, who was the CEO at the time, that we had to start talking about facility expansion to keep up with our growth and to keep up with the amount of services that we wanted to provide to the tribal population. When I came into Indian Health, Dennis Mcgee had taken a look at where we were in 1992, and he really was planning out 20 years on where would the clinic be looking into the 2000s. So when he wanted to build a clinic, which ended up being the clinic we're in right now on Rincon, he wanted to make sure we would have the space and the growth through 2020. Rose Cosgrove, Dennis Mcgee, the board at that time, Dorothy Ponchetti, Alice Ponchetti, Sam Pavel from Palma, Nadine Nelson from Paula. These folks were all invested not only into our current services, but they wanted to leave a legacy. What was this clinic going to look like in 20 years? In 1992, if you were to drive up to our Santa Isabel clinic, it's on the same site that our current clinic is now. But it was a 1,500 square foot double wide trailer. From that small trailer to the nice 6,000 plus square foot clinic that's up there now, that was built in 2004, and being able to add a lot of the things we do down at the Rincon Clinic. So to make sure, as we built our facilities and had growth, that the folks up the mountain at the Santa Isabel Clinic, folks from Mesa Grande, from Los Coyotes, even if they were coming up from the La Jolla Reservation, had that same great, not only customer service, but those same great facilities they were used to, and what they saw down at Rincon was also duplicated up at Santa Isabel. Both Dennis Mcgee and Rose Hatfield retired in 1999. Dennis was very clear on his communication as he went forward with his retirement on allowing people to be innovative in what they do, but to really set that improving the wellness of our tribal populations. Customer service was job one. And with Dennis, he knew and he passed on not only to other CEOs, so from Devin Parlakar to another longtime CEO of Ramel Maho McCauley, to Steve Gold, to myself, the importance of your staff. Those are your people that are working with our patients and our tribal population on a daily basis, providing the services. We have to keep those people invested in, keep them supported, and in the end, have a great relationship with those staff in order to be effective.
And I'm so proud of the people that are working in the facility and providing different services, medical care, dental care, optometry, all the services that people need, we have. So it's really been very gratifying to me and to the people to know that they have first-class services at their service.